Welcome to Live with Sara and Tasha. Of course, I'm Sara Hodson, the founder and CEO here at Live Well Exercise Clinic, joined by the amazing and ever so beautiful.
Well, thank you for that introduction. Tasha McRae. I am our VP of Brand and Culture here at Live Well.
We are Live Well's original CEPs and health coaches, dating back to 2011, where we worked in our very original clinic in White Rock, British Columbia, up on the 3rd floor, working directly with our members on the floor, having a great time.
And we're so excited that you're joining us today, because I think that's one of the things that Sara and I miss so much, is getting to work directly with the Live Well members. You know, she does get tired after some time of just staring at my face over Zoom from her desk. So it's so great for us to be able to get a chance to connect and share our passion for the power of exercise and behavior change with you today.
So again, this is for Tash and I, just this real opportunity to connect and meet with our Live Well family on a regular basis and see all of these faces from across Canada join us on our screen, which is a great reminder that if you can see your face, then we can see your face. We do love to see all of your smiling faces. So if you are comfortable opening up your camera, please do so, because we like to give you know, our clap here, our joy hands or jazz hands, joy hands. That's a great idea. I think we're going to
like that.
That's right on brand. So please feel free to open up your video and join us face to face. And if not, no problem. You can always just be part of the audience listening in today.
And we've brought everyone in on mute. So if you want to join in the conversation, we're going to encourage you to use the chat function. We have you muted for a couple of reasons, though we would love to hear your voice. We just want to get a nice clear recording, because we repost these on YouTube. And if you speak, you actually end up on YouTube being the center stage picture. And, you know, we just don't know if everybody's 100% comfortable with their YouTube debut on this call. So please use the chat function, and we'd love to hear your thoughts or your questions throughout the call today. So let's get started. We are talking today about blood pressure. And we've been talking about blood pressure in clinic as well throughout May, because May is hypertension month. So really wanted to just talk about it, get some education about it out there. At Live Well, we also launched this month a free online course called How to Lower Your Blood Pressure. It is open to anybody to take, not just Live Well members. We want to help the community at large help lower their blood pressure. So if you know somebody who needs a little bit of help, they're not on this call, you can certainly send them to this YouTube recording, or invite them to visit www.lowerbloodpressure.ca, and they can gain access to our How to Lower Your Blood Pressure course, taught by yours truly.
Ooh, lots of symphony and applause and excitement.
Sara,
I'm just the background.
Today my husband was home from work, and I said, oh, you'll need to be quiet because I'm doing live with Sara and Tasha. He said, you're doing what? I'm like, oh, Sara and I are live on YouTube and talking to our members across the country. He goes, wow, I had no idea. So
I tell my children that we're YouTubers, and they don't quite believe me or support it, but we believe that. Isn't this great? Doesn't everyone enjoy this though? Like, this is, for me, this is one of my favorite parts of the week, right, you guys?
No pressure.
Joy hands. Just joy hands. You love it, right? Yeah, I love it.
All
So
right.
why is blood pressure so important? Why is it worth us talking about? I'm sure that many of you have a few ideas, but it is important for us to know that actually high blood pressure or hypertension may have been a word that you will have heard. It's the same thing as high blood pressure, or what would I say? It's
Yeah.
synonymous with high blood pressure. It's
Also known as.
also known as AKA. It is the leading cause of death throughout the world, and risk factor for death throughout the world. And because of that, I mean, I think if you do have high blood pressure, you can probably relate to that. It is kind of a silent issue. So it is known as the silent killer. And because it often has really no warning signs or symptoms, sometimes we can think, oh, someone, they're getting all red in the face, they must have high blood pressure. It may be the case, it may not be the case, but hypertension in and of itself is very silent, meaning you could have high blood pressure for years and not know it, which is obviously putting yourself at greater risk. If you think of a really high flow of water going through a hose that has a lining on it, and over time it starts to kind of ruin the lining and debris and stuff starts to build. That's really what's happening in our arteries with high blood pressure. So it really is something that we have to be highly aware of. One of the things that I will say, yeah.
I was just going to say, Sarah, how many times have we met somebody who didn't find out that they had high blood pressure until actually had either a small stroke or a heart disease, because there really are no warning signs.
Exactly. And I mean, Tasha, if we even think through the last 20 years working in cardiac rehab and the last decade of running Live Well, how many people we see that get started with us and actually through exercise or just through coming into the clinic on a regular basis find out that their blood pressure is elevated. And sometimes it might be that, oh, we go to the doctor and it seems to be fine. The beauty of the exercise sometimes brings is that it actually kind of brings to the surface some of these early issues, and all of a sudden we can go, that blood pressure response wasn't quite as we expected. And we're going to get into exercise and blood pressure later, so I'll save the most ring part of our session today for our next conversation. But to get back to the facts, 9 in 10 Canadians will develop high blood pressure during their lives, and women with high blood pressure are at about a 3.5 times greater risk of developing heart disease than women who are normotensive or have normal blood pressure.
So really, really important to get it under control for sure. So we'll spend the majority of today's call talking about strategies for doing that. But first, let's talk about what is high, because these numbers are changing, and you may have seen that in media, that the target numbers are going lower and lower. And as new research comes out, there are people that I talk to who are like, oh, it's big pharma just trying to, get us all on more medication. But really, as research comes out that shows that the lower we get our blood pressure, or the faster we treat our higher blood pressure, the better off we do. They start lowering those targets. So right now, the target is that a normal blood pressure reading is anything under 120 over 80. So that's kind of what we consider optimal. So if you're in that zone, you're looking good. It means that when your heart is in the pumping phase of the heart cycle, the pressure in your arteries is 120 millimeters of mercury. And when your heart enters the relaxation phase, and there's not a surge of blood headed through your garden hose or your vessels, as Sarah was saying, then the pressure is about 80 millimeters of mercury. So that's optimal. Anything under that. And we often get asked about low blood pressure, so I'll address that in a few minutes. But 120 over 80 being optimal. So it used to be that 140 over 90 was sort of now this is high blood pressure, but they've squeaked that number down a little, showing that when your number gets to about 135 over 85, that starts to put you at higher risk. So this is when your doctor is going to want to start monitoring things a little bit more carefully and might be asking you to make some lifestyle changes or potentially start considering medication, depending on what other risk factors you have as an individual. Because it's really important to consider blood pressure in terms of your overall health, your age, your gender, your family history, whether you have a history of heart disease or diabetes already. So I mentioned diabetes, and diabetes and high blood pressure together are like a double whammy for the blood vessels. So high blood sugars irritate the lining of the blood vessel, and high blood pressure puts mechanical stress on the lining of the blood pressure. So we have a chemical stress and a mechanical stress, which leads to double the damage. And that's why people with diabetes who also have high blood pressure are at such incredible risk for heart disease. So if you have a history of diabetes, then they're going to want your number to be even lower. Of 130 over 80 is actually considered a high reading.
That
So
was just really beautifully said, Tasha. I really liked that explanation.
thank you, Sarah. I really
I
pride
just,
myself.
whenever we can build each other up, right? But I
Thank
really
you.
love the chemical and mechanical, and that just it. I think that it's a great visual for us to really understand how these things all work together. And sometimes we silos our health, right? And so I think it's so important that how do all of these things work together? And really what Tash and I want to spend the next little bit of our time together on is kind of solutions. What are the things that you can do to treat your blood pressure? So off the top.
Surprise, surprise.
Surprise, surprise.
Time to exercise.
Exercise. So this is so cool though, you guys. I really have to say that there's two things that I get really excited talking about during about exercise and the physiology, and like Tasha was saying, the mechanical and the chemical way that our blood vessels can really be damaged. And that is blood sugars and blood pressure. It is, to me, it is the body is this amazing vehicle that we actually have built in ways that our body can help to treat these. And that's where exercise is medicine. That term is not just kind of a nice little holistic way of saying exercise is a feel good thing. No, exercise actually changes the physiology of our body. And specifically around blood pressure, there is some key things that happen to help to change blood pressure now, immediately almost, and long term. And so the first thing is that I do want to say, in a world of instant gratification, and when we are looking for things to improve so quickly, and we think, I want to start exercising, in 2 days we jump on the scale and we get disappointed that we haven't lost weight. I'm going to tell you that treating your blood pressure with exercise is as close to instant gratification as we are going to get with exercise. And so I'm excited to share with you the very first thing that happens is there's it's actually a bit of a phenomenon, but it's called post-exercise hypotension. And what that means is that in as little as 10 minutes of exercise, when your vessels are expanding and contracting, they're, like Tasha said, they're pumping, that the blood is being pumped from your heart through the vessels of your body. And as you exercise, your blood pressure is going to increase. Naturally, we do want your blood pressure to increase with increased exertion, but that is a natural thing. But the amazing thing that happens at the end of exercise, in as little as 10 minutes of exercise, is that our blood vessels kind of go, and they relax and they open up, and our blood pressure lowers. This is called post-exercise hypotension.
And you've probably seen evidence of this on your card in the clinic. If you've had a day where you've come in and you've had your blood pressure taken at the beginning. So go back and look at your card, look at the times. And I know we're taking less blood pressures during COVID. We're taking less, let's just check in blood pressures so that we can keep distance. But have a look back, and what you'll see in most cases is that you might have come in, even if you have normal blood pressure, chances are you've dropped a few points. Yeah. And that drop can be pretty dramatic for some people. It could be a good 10 points on that systolic pressure.
How many of you guys actually have seen that before on your exercise card, where it's lower at the end of exercise than it was when you came in? Hands up if you've seen that before, right?
We've even had to send notes to people's doctors because after exercise, they're starting to feel a little woozy, right? And because their blood pressure is actually dropping too low. And sometimes we can see that when somebody's been exercising for a while, their blood pressure starts to drop over time, and they need to start coming off some of those meds because their body is doing the job for them now.
Which is really unbelievable. Like, again, this is what gets me so excited about that exercise is medicine, right? And so when we think about exercise as medicine, when we take a pill every day at the same time, so, if we're taking our cholesterol pill at bedtime every night, we take it every single day. The effects of exercise on our blood pressure has about a 24-hour life to it. Therefore, it makes a lot of sense that if we're going to be treating our blood pressure through exercise as medicine, if we think of it as a prescribed pill that we're taking at a set day, at a set time every day, it's great to exercise at the same time, therefore every day and every 24 hours. Therefore, the frequency and that dose is important. So if you go to a 9 o'clock session for exercise, making sure that every day at 9 o'clock, you're getting a little bit of a dose of exercise, that's going to give you the best management of your high blood pressure. As Tasha shared, through chronic exercise, we see long-lasting physiological changes that actually start to bring down your blood pressure, not just post-exercise, but all of the time. And an important thing to note, and we do this at Live Well, and I know that it's changed a little bit over COVID, but all of you have been just so game for all of the changes that we have done. But a warm-up and a cool down are very important. There are changes that need to happen in our cardiac output. Our body lags a little bit behind it. And so letting the plane take off and letting the plane land, those are very, very important components of our exercise program. But enough from me. Let's hear more from Tasha.
So let's move on from exercise, because I hope that we're preaching to the choir here. But the second big thing to really look at when we're talking about blood pressure is your diet. And a DASH-like diet, DASH is an acronym for a diet that stands for Dietary Approaches to Stopping Hypertension. And this is a diet that has been studied in and has been shown to be effective in people with blood pressure and in preventing high blood pressure in the future. And so it's not a shocking diet. It's high in fresh fruits and vegetables. They're high in dietary fiber, so making sure you're eating whole grains, things that are brown and nutty flavored. Looking at including non-animal protein sources so that you're decreasing your saturated fats and getting those low-fat dairy products into your diet. So that's sort of the crux of the DASH diet, and certainly you can look more into it. But following Live Well's 7 healthy eating habits is going to drive you really towards that very DASH-like diet. So a good place to start with your blood pressure. pressure is looking at adopting those live well, 7 healthy eating habits. A big part of hypertension management is salt in your diet, or sodium. And even if you're not somebody who uses the salt shaker at your kitchen table, or you try not to add a lot of salt to cooking, most of us are getting our sodium intake through restaurant foods and prepackaged foods. So being really careful, reading your labels. For prevention of high blood pressure, they recommend that we are not getting more than 2,300 milligrams of sodium a day. I gotta be honest, I'm not counting my daily sodium intake, but it is maybe something that just flipping the label, and occasionally I'll look at buying something and then go, oh my goodness, that's got 1,000 milligrams of salt in a serving. That's half of what I'm supposed to get in a day. That may not be the best choice in putting that down, especially if you're somebody who's has high blood pressure or is prone to having high blood pressure. And 2,000 milligrams, they drop it a little bit, the recommendation, if you already have high blood pressure. So 2,300 for prevention, 2,000 milligrams if you have hypertension. The American Heart Association has even gone a little bit further and is recommending 1,500 milligrams, where if you're eating some, restaurant packaged foods, pre-prepared foods, 1,500 milligrams gets tough to accomplish. So read your food labels, look at the places that it could be a high source of sodium for you, and see if you can reduce that. Some people are more salt sensitive than others. I know when I was working on the floor in the clinic, very first question I would ask somebody, if I suddenly saw high blood pressure that I didn't typically see, or it was creeping up to high normal, is I would ask, what did you eat last night? And for the amount of time somebody told me about their sushi or their Chinese food or something that had a lot of sodium in it, that was driving their blood pressure up. So people who are salt sensitive really have to be aware of that kind of thing. And though just having your blood pressure go up one day does not make hypertension, if you're eating like that all the time, it could be a problem. And then to really finish it off and be a total killjoy, let's talk about alcohol consumption. So the research is saying that to prevent high blood pressure, there's really no safe limit for alcohol consumption. And they recommend that, we abstain if at all possible. And I know you've probably read articles that say, but red wine is good for your heart. And when they really look at the big picture and even out liver this and this over that, there really is no reason to start drinking if you're not already a drinker. If you are a drinker and are just somebody who says, forget about it, Tasha, I'm not going to quit that right now, then think about drinking no more than 2 drinks a day is probably a good and safe recommendation. Smaller women may have to reduce that to 1 drink a day. Women don't metabolize alcohol as well as men do, and due to our smaller stature can likely handle less. So making sure that you limit that down to 2 drinks a day. That's all I'll say about diet, but we've got much more in the lower blood pressure course. So if you want to dig some more into that, either go to your healthy habit lessons in your member portal or check out that blood pressure course.
And based on that last topic of limiting alcohol, I'm feeling quite stressed out. And which brings us to the next point, that stress management is a key component of controlling our blood pressure.
And just to clarify for everyone, alcohol is not the solution to stress management.
Which is unfortunate, right? But true. And so really the way that we do deal with our stress can actually contribute to our blood pressure. So whether it be, you know, our emotional stresses, and it's also about how we are emotionally coping. So are we bottling things up and we are really stressing ourselves out with things? Is there some ways that we can calm and soothe ourselves? You know, I know that I've had to, you know, I've had a wee bit of stress over the COVID 16 months of, you know, making sure that we keep all of our Live Well members engaged and safe and happy. And I know that I've had to really learn all of the different ways that I can help to kind of self-soothe and to cope with my stress that don't include day drinking. Tasha said that was not an option for me.
I thought you said got. I thought you were about to call out that I hooked you on day drinking. I was really worried. What are you up to here, Sarah?
Tasha from the beginning said that was not allowed. But sometimes the ways that we cope with our stress are almost just as bad as the stress themselves. And so that's where people, like Tasha said, will turn to drinking or smoking. Eating unhealthy kind of comfort foods is a really common way for us to deal with those emotions and to kind of release that stress. And so, you know, what are the other ways that we can reduce our stress? And of course, not to continue to hammer it home, but exercise is really this win-win-win when it comes to hypertension, because exercise also helps us to reduce our stress. And so going to your Live Well session, taking a walk at the beach or in a park, making sure that we are managing our stress and being proactive with it, not waiting till those moments when we're about to really crumble and explode, but really knowing that along the way on a daily basis, we really have to mitigate and manage our stress, and managing our stress is a big contributor to our blood pressure.
Yeah. And the other thing we need to manage for our blood pressure is our waistline. And some of the things that we've talked about, obviously eating well and following a healthy diet full of whole foods, exercising and stress, those all contribute to weight. So they sort of cascade down. But we really want to look at weight loss isn't a simple cookie cutter approach. For anyone who's tried to lose weight, you know, it can be challenging, but maintaining, so if you don't have a weight problem, making sure that you stay on top of your weight is very important for your blood pressure. And if you are carrying weight, especially around the midsection, taking sort of a multidisciplinary approach where you're looking at weight loss from your diet, exercise, and those behavior modification pieces is really the way to go about it. So all of the things that Sarah and I have already talked about can help contribute to a healthy weight, but just know that your waistline does play an effect to your blood pressure.
And lastly is simply just taking your medication as prescribed. And I'm going to loop back to one thing that Tasha said earlier that I think is important, and that's that sometimes we are told and we find out and we see a measurement that we have high blood pressure and we think, give me time, and if I just do this, it will come down, and I'm going to try to hold off for as long as possible before I take those medications. But what the research tells us is that early treatment is actually really important, and the longer we wait, we're actually, if we hold off on having those medications and we allow the disease to progress, we're actually setting ourselves up to further the disease rather than if we started medication for early treatment. So taking our medication as prescribed on a daily basis, and you know, working with us at Live Well, in the sense that if you are exercising and your blood pressure is coming down, again, we are happy to communicate that information to your doctor. And it's fairly often that we will see blood pressure medications be changed, but it always does have to be in consultation with your physician. We can't kind of just feel like, oh, geez, my blood pressure has been doing a lot better, I'm going to start to take half of that pill. No, it's not as simple math as that. And there's a lot of factors we have to consider. And so we would always want your doctor to consult you on any of those changes.
Yeah, I think that's such a good point, Sarah, is because often people believe once I'm on a medication, I'll never get off it. And we see people come off their blood pressure medications all the time. But sometimes there are medications that you might be taking for your blood pressure, like a class of medications called ACE inhibitors, and they lower blood pressure, but they also play other roles in heart health. So if your risk is high or you've actually had some sort of a heart event, your blood pressure might be good and your doctor may be resistant to take you off that particular medication if you're not having symptoms of low blood pressure. So you're not feeling dizzy or really fatigued, that they might be resistant to taking you off simply for the other proven heart benefits that that medication may give. So really, really important to work in consultation with your physician to reduce your risk overall.
Yeah. So what to do this week to help you to live well? Well, it's important that you know your typical resting blood pressure because you need to know your numbers. So if you don't know what that is, you can get your resting blood pressure taken at LiveWell, at your doctor's office, at a pharmacy by waiting a few minutes. 5 is recommended if you have 5 minutes to sit there before taking your blood pressure. That would be considered a true resting blood pressure. And again, make several dates with exercise this week. If you're using exercise to treat your blood pressure, try to choose exercise on the same time every single.
Oh, I don't know if everybody is Sarah frozen for everybody or just me?
Week ahead. By
you were frozen.
Was it me?
You were frozen.
Oh, well, like the princesses, it makes sense. Plan. Did everybody hear my make your date with exercise? I got through that.
Got that one.
Oh, good. Then it's plan for your week by setting your weekly practice plan through your member portals, remembering that failing to plan is planning to fail. Did I say that right?
Yeah.
Yes, I did.
Failure to plan is,
yeah.
All right.
Overthinking it.
Don't forget to subscribe to our YouTube channel. I'm going to tell my husband to do it so he can catch all of the live episodes of Sara Tasha Live. He could really get some education here. I don't know what he thinks I do all day. And please join us next week, same time, 12 p.m. Pacific, 3 p.m. Eastern. And we are going to be discussing how to put an end to your excuses. Sarah and I have the magic bullet, so we're looking forward to sharing that with you next week. And we want to thank you all for joining us live today. If you are watching a replay of this and you are not a member at LiveWell Exercise Clinic, we'd love to invite you to be our guest. You can visit us at www.livewellclinic.ca to learn more about how we can host you as a guest at one of our locations.
Thank you for joining everybody. Joy hands. Joy hands. I love it. There we go. We will see you all next week. Take care.